Defining cancer as a metabolic disease changes everything. But what does that mean for our patients? And what treatment strategies can we offer in light of this new information? Well, stay tuned to find out. Now, cancer is already the leading cause of death in many Western countries. Since 1971, global spending on cancer research has exceeded $200 billion, and yet the cancer death rate in the US has decreased by just 5% since 1950. Why is progress so slow? Well, cancer is a complex disease, and detailed genetic analysis has shown that there are over 1,000 cancer-associated genes in humans. However, there is a glimmer of hope now on the horizon. New research reveals that cancer mutations affect just 3 metabolic pathways, the pathways that allow cancer cells to divide and grow out of control. Could it be that cancer is essentially a metabolic disease, similar to other chronic diseases like cardiovascular disease or diabetes? Well, today we're going to take a deep dive into natural health oncology. And our guides on our journey are no stranger to our Nutramedica audience, Dr. David G. Harper and Dr. Neil McKinney. Dr. Harper is a long-time health educator and cancer researcher. He's also an associate professor of kinesiology at the University of Fraser Valley. And Dr. Neil McKinney is also with us today. Dr. McKinney is a doctor, a teacher, and an author with 35 years of clinical experience. He is a pioneer and leader in naturopathic cancer care. Welcome back to Nutramedica, gentlemen. Nice to have you with us today.
Good morning.
My pleasure.
So I'm going to start with you, Dr. Harper. What do you mean by, or what do we mean by metabolic disease, and why is it so important that we start to understand cancer as a metabolic disease?
That's a great question. It's a question for the times, I think, Brian. So in general, if we want to look at things at the cellular and molecular level, and that's where most of the research is focused these days, what goes on in the nucleus with the genes and gene activation and so on, that's referred to as genetic. And what goes on outside of the nucleus between there and the cell membrane is what we call metabolic. And really, metabolism is just the sum total of all the chemical reactions that occur in your body, including those reactions that occur in the nucleus. But from a medical, clinical perspective, metabolism is really about the way we use energy in our bodies. And depending on how you use that energy, you have different outcomes. And when we look at disease, what we've realized in the last 10 years in particular is that most of the chronic disease that plagues humans, especially in the West, which, as you mentioned, cancer we're talking about today, but also cardiovascular disease, diabetes, Alzheimer's, these are all now being reframed as metabolic diseases and investigated from that perspective. So if we come back to cancer, our subject of discussion today, for about the last 30, 40 years, since those genetic tools have come online, we've investigated the thousands of genes that are related to cancers. And as you know, genes produce proteins. And so we can use tools called proteomics to look at the proteins that those genes produce, see how they differ from normal cells, and then view all of that as targets for drugs, essentially. So although there's thousands, I suppose, of identified oncogenes or cancer genes, there are hundreds of thousands of pathways there, or at least tens of thousands that you can identify and develop drugs for. And we've done a really good job of doing that because we have these sophisticated tools. The problem lies in the fact that they work really well, but only for a short period of time. And then because cancer cells are so adaptable, they kind of work around whatever roadblock you put in the way with these drugs. And then you're right back at the start again, which is why, as you said at the start, we've had such a challenge. So now that we're revisiting cancer as a metabolic disease, it's much simpler.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel. And don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.